opposition on a bill being heard today. There are white sign-in sheets at each entrance where you may leave your name and other pertinent information. Also, I would note, if you are not testifying but have an online position comment to submit, the legislature's policy is that all comments for the record must be received by the committee by noon the day prior to the hearing. Any handouts submitted by testifiers will also be included as part of the record as exhibits. We would ask, if you do have any handouts, that you please bring 10 copies and give them to the page. We use a lighting system for testifying. Each testifier will have 3 to 5 minutes to testify. Today we'll go 5, depending on the number of testifiers per bill. When you begin, the light will be green. When the light turns yellow, that means you have 1 minute left. When the light turns red, we eject you out the roof. No, we don't do it quite that way, but that's time to end your testimony, and we'll ask you to wrap up your final thoughts. When you come up to testify, please begin by stating your name clearly into the microphone, and then please spell both your first and last name. The hearing on each bill will begin with the introducer's opening statement. After the opening statement, we will hear from supporters of the bill, then from those in opposition, followed by those speaking in a neutral capacity. The introducer of the bill will then be given the opportunity to make closing statements if they wish to do so. On a side note, the reading of testimony that is not your own is not allowed unless previously approved. We have a strict no prop policy in this committee. With that, we will begin today's hearing with LB 1181. Welcome, Senator Ballard.
Good afternoon, Vice Chairman Hardin and fellow members of the Health and Human Services Committee. My name is Bo Ballard. For the record, that is B-E-A-U, B-A-L-L-A-R-D, and I represent District 21 in Northwest Lincoln and Northern Lancaster County. I'm here today to introduce LB 1181 on behalf of the pharmacies and pharmacy techs. LB 1181 makes six simple changes. In Section 1, it would change the annual inventory requirements. Currently, under state law, pharmacies have to take inventory of controlled substances in their possession every year. This bill would change that requirement to every other year, mirroring federal law. Section 2 would allow pharmacists to add or change the dosage, form, drug strength, drug quantity, direction of use, and issue date for Schedule II drug substances after consulting with this prescribing practitioner. This codifies with current DHHS stances on this issue. The next change is a reporting requirement dealing with inspections. Currently, facilities and pharmacists have the facilities inspected by third parties or conduct a self-inspection. If they do, there's a form that must be submitted to the department. The forms are cumbersome and they're modified from time to time without notice, and there are different pharmacies and hospital pharmacies. In Section 4, this would establish a single form for all pharmacies and require the department to approve the form on an annual basis. If the form is not approved in a timely manner, a self-inspection or third-party inspection would be an option for the next year. This bill would also have changed the age requirement for pharmacy interns. This was brought to our attention by the UNMC because of their first-year students are the only age of 18 years old. This has an amendment, if I may, Mr. Vice Chairman. Current bill says there's a 17-year of age. There is an amendment where we're changing it to 18 years. So UNMC says we have freshmen that are 18 years old. Currently, there is a 19-year-old requirement for interns. This would change it to 18 if the committee opts to adopt the amendment. Change number 6, it would change the lifetime ban for non-alcohol drug-related misdemeanors to a 5-year restriction. Finally, this bill addresses the Attorney General's position in prescribing labeling. Prescriptions are required to contain a patient's name. However, this does not work for immunizations or drugs used in emergency. Those drugs would be allowed to label for use of emergency. These changes are common sense tweaks for pharmacies, help cut red tape, and create a more efficient healthcare system. I would be happy to answer any questions, but there are testifiers behind me with expertise.
Wonderful. Any questions from the committee?
Can you let me go, Mayor?
Yeah. Senator Ballard, will you stick around to close?
I will be here.
Wonderful.
Thank you.
Is there anyone who supports this? if you'd come forward. Hi.
Good afternoon. Hello,
Hello.
Vice Chair Harden and members of the Health and Human Services Committee. My name is Marcia Muting, MarciaMueting. I'm the CEO of the Nebraska Pharmacists Association, a registered lobbyist, and a pharmacist. So many thanks to Senator Ballard. There he is. For introducing 1181. LB 1181 is a pharmacy practice cleanup bill. And our hope is to streamline regulations and decrease administrative burden for pharmacies and for DHHS. I'm going to address a few of the changes in the bill, and I'm going to be followed by colleagues who will speak to the other changes in the bill. One of the changes I'm going to chat about is clarifying the changes that can be made by a pharmacist after consulting with the prescriber to a prescription. Nebraska's Board of Pharmacy developed a policy which was published in a newsletter in February of 2009. So the Board of Pharmacy got together and created a policy on what changes can be made on a prescription for a C2 controlled substance. C2s require a prescription, a written prescription. They can't be phoned in. They can be electronically prescribed, or they're written. So basically the final draft needs to show up at the pharmacy. So they've created a policy that allows, after consultation with the prescribing practitioner, usually a phone call, a pharmacist may add or change the dosage form, drug strength, quantity, directions for use, or issue date. Okay, so why would we need to do that? So if you come to Marcia's Perfect Pharmacy with a prescription, for example, for pain medication, oxycodone 10 milligrams, and I only have the 5 milligram tablets, my option is to send you back to the practitioner for a new prescription. Maybe they can prescribe it electronically and you could have your prescription in 10 or 15 minutes. Or I can make the changes where I adjust, after talking to the prescriber, you wanted the patient to have 30 tablets. I only have the 5 milligram. Let me give them 60 tablets. We'll have them take 2. So it's not anything more changes than that. The intent of the prescription remains. As far as the dosage, we're not changing the dosage. We are modifying the number of tablets. And so this is codifying policy that's already in existence from the Board of Pharmacy. It's never been in statute. So a lot of pharmacists call and ask, where does it say which changes I can make on a C2? So that is one of the reasons that we chose this particular policy to actually make into statute. The next provision is about the self-inspection report. When I first became a pharmacist, pharmacies were inspected annually on site by a pharmacy inspector who was a pharmacist. The self-inspection report replaced the on-site inspection when we no longer had enough pharmacy inspectors to cover all of the pharmacies across the state. Each year, pharmacies and hospitals complete this self-inspection report called the PQAR, or the Pharmacy Quality Assurance Report. Right now, there's a separate report for hospitals and a separate report for community pharmacies. What we're hoping this bill will do is to, because the PQAR has not been revised since October 17th of 2019, it cites federal laws that are out of DHHS's jurisdiction. We've met several times with DHHS to talk about the concerns we have with this quality assurance report, the self-inspection report, to voice concerns about errors and confusing questions. And we have not had any resolution. So what LB 1181 will do is require the members of the Board of Pharmacy to at least once a year look at this report, review the report, make sure it's right, it's accurate, and allow for public comment. The final thing that I'm going to discuss is a change in medication labeling statutes. A prescription is usually written and labeled with a patient's name. In some cases, medications need to be provided for someone without a specific patient. So I'm talking about a prescription written for emergency use that can be labeled for emergency use. Examples include Narcan or an epinephrine autoinjector This will make it easier for schools to adhere to the Air Nebraska Act, where they can get epinephrine to have on hand, and EMS. I'd happily answer any questions that you have about the three provisions that are covered in this law.
Thank you for being here.
Sure.
Are there any questions? Senator Reapy?
Thank you, Chairman. One of the questions I had, correct me where I'm wrong, the pharmacist does not have the prerogative of moving from a brand to a generic drug.
Actually, Nebraska law does allow us to do that
Yeah,
if the FDA says that they are equivalent.
Okay,
So they have to be listed and as such, as far as being bioequivalent. The FDA has tested the brand and the generic, and they have found them to be equivalent.
Okay.
So yes, we can switch from brand to generic or generic to
is
brand.
that information readily available to the pharmacist so that they don't have to read the 1 or 2 font on it?
It is. A lot of times we can receive that information from our wholesaler, and at Marsha's Perfect Pharmacy, I would only order in generics that were equivalent.
Yeah,
Yeah.
okay,
So whatever's on my shelf would work.
okay, thank you.
Sure. I'm glad you asked. Senator
Hi.
Kavanaugh.
Senator Kavanaugh?
Sorry, I got here a little bit late.
That's okay.
You said that they're about the for emergency use or use in
Yes.
immunizations, labeling laws. Are those state labeling laws?
State labeling laws,
For
right?
How something is labeled on a prescription pad?
How something is labeled on the prescription container.
Oh, okay, on the container.
So we were able to successfully change the law to allow a prescription to be written for emergency use, but we neglected to update the statutes for the labeling. So the way it is right now, a prescriber can write a prescription for emergency use, but then it still has to be labeled with the individual patient's name.
Okay, thank you.
Yes.
Very good. Any other questions? Tell me a little bit more about that middle one that you discussed in terms of the self-inspection.
Sure.
Unpack that a little bit for me in terms of DHHS has seen it, but is it essentially, we're just coming into parallel with the federal? Is that what you're saying is going to happen there?
No, there's no federal inspection.
Okay,
The FDA can come into a pharmacy, I suppose, and inspect them if they wanted to.
but there are no federal recommendations for how that self-inspection takes place.
No,
Okay,
no. We used to, like I said, when I first practiced pharmacy, the inspector would show up once a year at your pharmacy and kind of, they had a checklist of things they wanted to check, make sure that the drugs are being stored under safe conditions, that there wasn't a can of Coca-Cola in the refrigerator where the insulin was stored.
I see.
Or other specific examples. And now we do the self-inspection report, and our concern is the report itself.
Okay.
We're happy to fill out the form. We're happy to do the self-inspection. The problem with the form is that some of the questions don't make sense, and some of the references on the form itself are incorrect.
Can you give us an example? Because we're all new to this.
I should have brought that, no, but I can get something to you that will show you where the statute, either the Nebraska statute or it cites federal law, which our inspectors don't enforce federal law.
Okay.
So why would you be self-inspected on something Nebraska doesn't
Gotcha.
enforce? But yeah, I'll get you some examples. I've got one marked up at the office.
Very well. Thank you.
You bet,
I appreciate you being here.
of course.
Thanks. Anyone else in support of LB 1181? Welcome.
Thank you. My name is Terry Miller, and good afternoon, Vice Chair Hardin and the other members of the Health and Human Services Committee. So my first name is T-E-R-I, last name Miller, M-I-L-L-E-R. I am a pharmacist licensed in 9 states, and I also serve on the faculty as a licensure coordinator at Creighton School of Pharmacy and Health Professions. So that is a slight correction. This bill was initiated by me in terms of this addendum to the age requirement. And I'm here today to express support for LB 1181, which would change the minimum age required to apply for a pharmacist intern license to 18 for the following reasons. It would create a reasonability to align with a minimum pharmacist licensure age of 19 in Nebraska, as well as a previous pharmacy technician licensure minimum age exemption to age 18 previously. So it would also allow Nebraska to become synonymous to the majority of other states' minimum age requirements. It would increase the ability to fill the local job market for an in-demand skill set. It would keep talented, bright graduates from encountering barriers to remaining in Nebraska or coming to Nebraska for education immediately after high school. So the National Association of Boards of Pharmacy compiles a survey of pharmacy law, which I've got here on my desk. And they do this annually, which includes all 50 states and 3 territories. And one category is age at which initial pharmacist licensure can be obtained. The age of pharmacy intern licensure isn't addressed, but could be reasonably extrapolated. So in this survey, 37 states and territories have an either unspecified or minimum age of 18, which puts Nebraska universities at a deficit for attracting continuously emerging younger students because of AP college credit gained in high school. It's common for current pharmacy school applicants to have prerequisite credits completed in high school, which lowers their average age of acceptance into professional school. Initiatives to provide high school students with the ability to take more college level coursework during high school, and in some cases earn an associate's degree along with their high school diploma, has been increasing, which will ultimately lead to a younger pharmacy school applicant age. When potential bright students investigate the state requirements and perceive an age-related roadblock, they often move on to continue their education elsewhere. So I appreciate your time and I welcome any questions.
Questions? Yes, Senator Reed.
Thank you, Chairman. I guess the question that comes to my mind is, if you have an internship versus, what I'm accustomed to is you have employment as pharmacy staff, oftentimes very young people, who then learn and decide whether they, because they're working in the environment full-time or part-time, they learn, I would think, the same thing that an intern's going to do.
For a technician, you mean? A technician learns the same thing?
Yes, I guess, yeah, technician's the right term, not staff.
So a technician can't do anything that involves judgment, but an intern, even though they may not, are technically allowed to do anything that a pharmacist can do with the pharmacist's supervision. So it may be a situation where either the intern or the pharmacist says, for right now, let's just stick to these tasks. And then as you continue here and work in this experiential experience, we'll move on to more judgment involved activities. Technicians can become technicians here in Nebraska at age 18. That was an exemption granted previously in Nebraska, but it makes more logical sense if a pharmacist can become a pharmacist at age 19 in Nebraska to not allow them to become an intern, which is part of the experiential program. It doesn't really make logical sense. So
it would seem to me, not to be argumentative, but I would hope that the pharmacist is also going to be supervising not only the intern, but they certainly clearly better be supervising the technician. And I would put my money on a technician that's been there for 6 weeks or a month or whatever, as opposed to a brand new high school 18-year-old coming in because maybe he has some expressed desire to be a pharmacist.
Well,
who knows?
right now, there's quite a bit of turnover, especially in the community or retail environment with technicians. So they learn, they can't become a technician until they're 18. So when we're talking about that year difference, for example, we've had 11 students who would have entered our program as age 17 or 18 once they enter professional school. So we either had to tell them, you can't become an intern here in the state of Nebraska until you're 19, which in the competitive field of pharmacy schools, that whether you're talking about UNMC or Creighton, they're going to move on to something else because they're not going to take a gap year and waste that time if they're that motivated of a bright student to have accomplished so much in the short time. The other thing is the states that border Nebraska, Colorado and Iowa, they don't address age when it comes to pharmacist licensure. And then South Dakota and Kansas, their age of pharmacist licensure is 18. And obviously this is intern, but it would make sense that you could become an intern prior to becoming a pharmacist. So
Do you have technicians that go into pharmacy school?
we have, it's becoming more popular. It has not always been the case, but we're seeing more and more of that. I sit on the admissions committee for Creighton. I have for 15 years. I've been on the legislative committee at NPA for 13 years, and I've decades of a membership. So the testifying is new to me, but the integration with what the NPA does is
In
not.
a conversation with the dean of your school of pharmacy,
Mhm.
he shared with me that, and I respect this, that they were unsuccessful in filling all of the slots for an incoming pharmacy class. So is this part of an attempt to round up some interested students to become applicants to the college?
Well, just to be clear, our dean is Amy Wilson, and it's a she, and she is in support of this. Like I
Who's
said,
this?
Amy Wilson is our dean at Creighton. She's the
Oh,
dean of the
okay.
pharmacy
I was
school.
talking to the dean of the med center.
Yeah, so, but like I said, the clarification is I'm from Creighton. I'm not from the Med Center, but I know that was errantly stated initially. But we've had students over the last 7 years that have been 17 and 18 years. So this is not a new problem. We have some really bright students that we've had to turn away or say, in our state, you can't become an intern until you can become a pharmacist, which doesn't make sense. But the supervision, the pharmacist takes on the responsibility for supervising an intern. And there are many qualifications they have to accomplish in order to get an acceptance to pharmacy
So
school.
are you struggling to fill your classes?
Every pharmacy school is struggling to fill slots, if you want to call it filling a quota, but we at
Well-
Creighton we're not going to admit somebody that we don't believe can get through the program. That's a
Well,
waste.
that's true at the med center too. Okay, thank you, Jim.
Thank you very
Any
much.
additional questions? I have one, which is, I'm just curious, how did 17 get to be a thing?
We were just talking about that it was kind of a misunderstanding when we were thinking about the age. We were thinking about 18 being the age, but 19 is the age of pharmacist licensure. So 18 is really the reasonable number that we were going for to make it synonymous with other states and make sense.
Very good.
Okay,
Thank you.
thank you.
The next person in support. Welcome.
Thank you.
Thank you.
Vice Chair Harden and the members of the Health and Human Service Committee. My name is Haley Pertzborn. That's spelled HALEY PERTZBORN. I'm a licensed pharmacist and the Executive Fellow of the Nebraska Pharmacists Association. I appreciate Senator Ballard introducing LB 1181. As discussed, this bill will help reduce administrative burdens for pharmacies and hospitals and increase eligibility for the pharmacy technician workforce. On page 2, LB 1181 addresses matching the federal law on controlled substance inventory. Currently, pharmacies are obligated to submit an annual report to the department while also maintaining a daily controlled substance inventory. The change in LB 1181 will modify the frequency of counting and recording the controlled substances to every 2 years instead of annually, mirroring what is in federal law. This doesn't change the requirement for pharmacies to keep and maintain a complete and accurate record of all controlled substances on hand, but decreases the added administrative burden of submitting an annual controlled substance inventory to the department. On page 8 of LB 1181, it also addresses a hurdle for pharmacy technicians. Currently, an individual with a prior non-alcohol drug-related, non-alcohol stated as alcohol is considered a drug, drug-related misdemeanors has a lifetime ban from being a pharmacy technician in Nebraska. If this bill should pass, it would address cases like a 30-year-old individual who had a drug-related misdemeanor when they were 18 and wants to become a pharmacy technician, but is banned for life under the current state law because of a past mistake when they were young. This provision would modify the requirements to only include non-alcohol drug-related misdemeanors within the last 5 years. Thank you for your time today, and I would be happy to answer any questions.
Thank you for being here. Any questions? That seems fairly straightforward. Are you aware of anything else that's similar to that where we have changed the approach?
Are you talking about the pharmacy technicians? Or?
Right. Well,
Yeah.
I'm talking about with the banning.
Mhm.
We take a look at someone record and we go,
Right.
uh-oh, we
Yeah.
can't let this person.
Right.
Are you familiar with anything else within the medical community where it has
Mhm.
worked in a similar fashion and then changed? Or is this kind of a new frontier?
Yeah, I am not, but I can certainly kind of check more into it and get back to you if
Okay.
I find anything.
Okay, I'm just curious.
Yeah, of course.
Thank you.
Yeah, thank you. Good.
You bet. Anyone else in support of LB 1181? Anyone in opposition to LB 1181? Anyone testifying in the neutral for LB 1181? Welcome.
Thank you. Good afternoon. Paul Henderson, PAULHENDERSON, testifying on behalf of the Nebraska Medical Association. We discussed this bill with our members. They're particularly interested in Section 2 of the bill, which is the section authorizing pharmacists to make those changes to Schedule 2 prescriptions after consulting with the prescriber. And that consultation is really the critical piece for us. Physicians take their prescriptive authority very seriously. So we appreciate that that's in there. And certainly our members can see the value in reducing delays for patients after they have that conversation with the pharmacist. We're neutral today because our members were conflicted about whether this is something that should go into statute. It's our understanding the DEA currently allows this, but has flip-flopped a little bit in recent years, as recently maybe as 2022, on whether this is a change the pharmacists can make, which just creates a little bit of a potential for some conflict between state statute and DEA policy. And they felt this could lead to some confusion, and perhaps this would be better addressed through a joint policy of the Board of Medicine and the Board of Pharmacy. But certainly we can understand the pharmacist's position that they want some clarity and some certainty in what they're allowed to do. So that leads us to our neutral position today.
Wonderful. Does anyone have a question for my edification? Can you make up a hypothetical for me so I can get my head around that a little bit better? Cite an example of something fictitious that could go wrong here.
So I think the potential that our members were concerned about is if, this is enacted and next January, the DEA issues a rule and says, no, pharmacists cannot make a change to a Schedule 2 prescription. Then we've got a state statute that says one thing and a DEA policy that says another thing, which just creates some confusion.
Makes the pendulum swing. Okay. Very well. Thank you.
Thank you.
Appreciate it. Anyone else in the neutral? Seeing none, we'll invite Senator Ballard back to close. We had one proponent letter, one neutral, and no letters in opposition for LB 1181. So he's waving at us. That means we're done with that one. Well, let's get started on LB 1130. Welcome, Senator Raybould.
Thank you. Good afternoon, Vice Chair Hardin and members of the Health and Human Services Committee. My name is Jane Raybould, JaneRaybould. I represent Legislative District 28 in Lincoln and appear before you today to introduce LB 1130. LB 1130 is a bill that intends to give us one more tool in the toolbox of addressing our shortage of licensed mental health practitioners, LMHP. An issue I know you have heard about over the interim. As a matter of fact, it was over the interim when my constituent, Nahora Maritza Andrade, contacted me and her story became the genesis of this bill. Ms. Andrade is an educated and experienced practitioner, and until this summer was working toward becoming a fully licensed LMHP. Having come up short on the required 3,000 hours of supervised experience, she went to the department to file an application for a third provisional license. There she learned that there is nothing in Nebraska law to allow for successive provisional licenses after the second or an opportunity for an extension. Unfortunately, Ms. Andrade had been misinformed about the existing limitation, and since introducing LB 1130, my office has heard from others who believe that additional provisional licenses could be obtained. Ms. Andrade asked if she could appeal to the Board of Mental Health and was told that the only way she could ever be licensed to work as a mental health practitioner in Nebraska was to go to another state, such as Iowa or Colorado, and become licensed there. Then she would be able to practice in Nebraska on a reciprocal license. So here we have someone with the education, several years of experience, a commitment to serving individuals in need of mental health care, and a desire to live and work in Nebraska, yet we have nothing to offer her but the suggestion to leave. I was unaware whether this was a pervasive problem and would like to thank members of the Nebraska Association of Behavioral Health Organizations who took the time to share their feedback and thoughts on this issue. With their help, I learned that it is rare that individuals are unable to complete their 3,000 hours of supervision. However, we do know that it happens. So rather than large sweeping changes, I have proposed a simple solution in LB 1130. Here is what this bill would do when the holder of a second provisional license is unable to complete their supervised hours due to a demonstrated hardship. They may file an appeal with the Board of Mental Health. The hardship which contributed to the inability to complete their supervised hours are limited to: 1, ongoing medical issues of the provisional licensee or his or her family. 2, a documented inability to secure adequate supervision. 3, or other barriers that the board deems appropriate. Following the appeal process, the bill states that the board may grant a third provisional license for a term of 5 years. Additionally, the bill requires the provisional licensee to provide the board the name and contact information and permission to discuss the provisional licensee's employment for all individuals who have provided their supervision during the term of their first and second provisional licenses. The intent of this is to ensure that the board has sufficient verifiable information they need to carry out the due diligence necessary to aid in their determination. Lastly, the bill allows the board the ability to adopt additional requirements for granting an appeal. In Ms. Andrade's case, she struggled to secure the necessary supervision to complete her hours. I cannot say that upon passing LB 1130, Ms. Andrade will qualify for a third provisional license, but what I do want to make possible is that opportunity for her and others to make their case under an appeal, and that the board members who are qualified and informed on these matters have the ability to make that determination. I want to say thank you very much for your time, and I will certainly be happy to answer any of your questions. I know I have one other handout who is from someone who has been on the Board of Mental Health and involved in licensing for over 10 years. And she said, you know, it is rare, but this does happen. And we hate to see these people that have their provisional license and have practiced in the state of Nebraska to be turned away. So with that, I'm more than happy to answer any questions.
Thank you. Are there any questions? Senator Reevy.
I have a quick question. Welcome for being, thanks for being here. Welcome.
Yeah.
Is Senator Frederickson a co-sponsor?
I don't.
His name's mentioned in this one document.
I'm looking at my staff. They say yes.
Okay.
He is.
He is, okay.
And so I want to be clear that we reached out to Mental Health Association of Nebraska to have them review and solicit and make any changes. And they did make some suggestions that we incorporated. And also, we received a letter of support from the Nebraska social workers saying this is a very good thing. And we're happy that someone is introducing this minor change to give people that additional time once they demonstrate the hardship.
I'm not afraid to get crossways with some of these organizations, but at least I like to know it when it's going to happen. So it sounds like you're in good stead, Bill.
I
Okay,
think we've
thank you.
reached out to all the stakeholders.
Okay, thank you.
Any other questions? What would the potential downside be? Has anyone brought up a potential downside of extending a third opportunity?
No one has ever mentioned that, and there is no fiscal note. There's no cost. But the thing is, every time you apply for a license renewal, which you can get one at this point in time, you still have to pay that license renewal fee. And so I'm assuming for this third provisional license appeal that they would require you to pay the fee as well.
Okay, great. Senator Rapey.
Thank you, Chairman. Question I would have is do they have such a thing as peer review? I'm interested in protecting the public from going down this road with a counselor who is, quite frankly, no better off than they are. So I think peer review is an important thing in most of these human services.
Well, I could agree with that statement more, but I know that with the mental health board, they have specific criteria for those that and that they must qualify either by their education, hours of supervised or unsupervised. So there is tremendous requirements already in place that are pretty well established for years that any candidate must have the
And
bare
maybe
minimum.
what they need is a secret shopper, that someone goes in there and gets counseling and then comes back and says, they're really in need of counseling themselves.
Well, I think with the idea of the 3,000 hours of working with a supervisor, you go over all your caseload and you talk about the recommendations and the practices that you are working with this particular client. And does this meet the criteria of that practice and the mental health standards of best practices?
Okay, thank you.
You're welcome.
Any other questions? Secret shopper. That's an
That's a grocery
intriguing
thing.
concept. Thank you, Senator. Will
You're
you
welcome.
be staying for closing?
I will.
Wonderful. Do we have anyone in support of LB 1130 who will be testifying? Anyone in support? Do we have anyone in opposition to LB 1130? Here's one now. Welcome.
Good afternoon. My name is Scott Stocking, Scottstocking. I'm a public member of the Nebraska State Board of Mental Health Practice. I come before you on behalf of that board today to oppose Legislative Bill 1130. First, the most straightforward objection to this bill is that it would allow a third 5-year provisional license for candidates when the current statute does not allow a second license. Title 172 NAC, Chapter 94 expressly states no additional provisional licenses will be issued to an applicant after the issuance of a second provisional license. The second license should not be used as an excuse to take another 5 years to get the required hours. Allowing a third such license in the statute when NAC forbids it is poor legislative precedence and could potentially lead to legislative and legal challenges. We ask the sponsors to withdraw this bill immediately. Second, the main purpose of issuing a provisional license is to provide legitimacy to the candidate earning a full license. Its purpose is not to flood the field with undertrained and underexperienced persons to provide mental health care. Achieving the necessary 3,000 contact hours over the 5-year term of the initial provisional license is roughly equivalent to 12 contact hours per week. The state deems this intensity to be sufficiently rigorous with weekly supervision for a provisional licensee to hone their counseling and people skills. Each subsequent license dilutes the intensity and rigor of the on-the-job training and supervision and potentially reduces a supervisor's confidence in the quality of their training. Lack of such quality and consistent training presents a risk to the health and safety of Nebraskans who need quality mental health care. Third, provisional licensees are not required to report any continuing education to maintain their license since they are being supervised. A 3-time provisional licensee could go up to 15 years without any required updates to their education and training. When compared to someone who completed their contact hours and earned their license after 5 years, the 3-time provisional licensee would have missed out on up to 160 hours of required continuing education. If their training isn't up to date, we're wondering who would want to supervise them. Since securing a supervisor is one of the hardships outlined in the proposed amendment, the board is concerned there may be legitimate reasons unrelated to medical issues why a provisional licensee cannot secure a supervisor. Fourth and finally, determining what hardships due to ongoing medical issues of the licensee, to quote the amendment, could legitimize a 3rd provisional license would open a Pandora's box of potential complaints and accusations of unfairness and inconsistency in the weighing of relevance of such issues. This could also lead to legal liabilities for the state. Because the board is primarily made up of mental health professionals and not medical professionals, will the board be qualified to make judgments about how the applicant's medical history would have impacted their ability to complete their requirements or even perform their duties competently? If the applicant experienced medical issues that cause memory loss or other cognitive or psychosocial issues, how would the board determine what mitigation, if any, were possible, would be needed to ensure no gaps in training or knowledge? It would be extremely difficult for the board to establish any kind of consistent standards to evaluate these one-off situations, which could result in complaints of discrimination or unfairness if an applicant felt unfairly treated. In summary, then, we believe allowing a 3rd provisional license potentially dilutes the quality of training intended by the 3,000 contact hours requirement, reduces the amount of lifelong learning from CE requirements, and creates significant potential for accusations of discrimination or liability for the state. Of course, all this would negatively impact the quality of services provided to residents of Nebraska, who are our utmost concern. Finally, as I said at the start, we believe that allowing a 3rd provisional license when the current statute doesn't allow a 2nd would create legal and legislative issues for the state, especially if such a law were challenged in the courts. One final note, the board had an overall consensus that even if this law were passed, we would be extremely reluctant to approve any application for a 3rd such license based on the existing rule and these reasons given today. We strongly urge the committee to withdraw LB 1130 to protect the mental health and safety of Nebraska residents. Thank you for your attention. I yield my time back to the chair.
Thank you for being here.
Thank you.
Are there any questions? Unpack it a little bit more for me, if you wouldn't mind. It sounds like we're saying a 3rd provisional license, and you pointed out to us, and it's news to me, that we don't even have language for a 2nd one.
It's in
We
the,
evidently didn't get our math just quite right on that one.
the 2nd one is in the administrative code.
Okay,
It's an allowance
in allowance.
or a concession, basically.
Okay. And so in your experience, it's highly unlikely that while this can happen, 12 hours or cases, situations a week for 5 years should accomplish that 3,000 hours.
Mhm.
Okay. To your recollection, how often does this situation potentially present itself where someone cannot get through that initial 3,000? Is that a real common thing? Has it happened once, 100 times? Help us to understand, because this is where we get educated.
Yeah. I can't speak to that personally because I'm, first of all, a public member. I'm not a professional in the field. But when we had the discussion with the board, they did say that they only had one request for a third provisional license, and it may have been the one that the senator referenced in the last year, and that's probably because it's not allowed in the statute at all.
Okay, very well. And you're saying that 160 hours would be lost over a period of 15 years?
Of continuing education hours.
Okay, very well. Any other questions? If not, thank you.
No,
Thank you.
Oh, I'm sorry, we do have one, Senator Kavanaugh.
Sorry, thank you. Thanks
Hi.
for being here.
Mhm.
So I just want to make sure, and I don't know, have you testified before?
This is my first time to
Your first
testify.
time. Well, thank you. For
Before
being-
the state, I've testified in other settings.
Well, thank you for being here and
Mhm.
thank you for testifying. Typically, it is helpful if you bring your objections to the introducer in advance so that they can work with you to address some of them. Did that happen with these objections?
I was not advised to do that.
Okay. Well, I wasn't sure if you had done that or not. So I think it oftentimes, and I will let Senator Raybould speak for herself, when there are concerns, especially by the board itself, we'd like to work with you on that. And I think that might be a great opportunity to see if we can address some of those concerns through an amendment of the bill. Is that something you'd be open to?
I would have to take that back to the board. One of the concerns we had was that we were told this was a shorter session and things were being rushed through, and we really didn't have time. We had to schedule a special 1-hour online meeting to
I
to cover
understand.
things, so-
And this got an early hearing as well, so.
Yeah.
But it seems like we might have an opportunity for further discussion on how to improve the bill. So thank you for being here and thank you for your testimony.
Thank you.
Thank you.
Anyone else in opposition to LB 1130? Seeing none, anyone in the neutral for LB 1130? Seeing none of those, would you come on back up, Senator Raybould? We did have 4 proponents, 0 opponents who wrote in, and 1 in the neutral.
Thank you very much. Yes, I would have greatly appreciated Mr. Stocking reaching out to me beforehand. But I want to assure everyone present that we did reach out to the Mental Health Board. And basically, I had one meeting in my office with them, and they said basically their hands are tied. They administratively have no authority to issue any third provisional license. At this point in time, they have no authority whatsoever. And what this would give them that discretion, they said the legislature needs to come back and make the changes and give us that authority. Ms. Andrade also had an attorney and recognized that they have no recourse and nowhere to go because the administrative standards of the Mental Health Board are very clear. Very clear. There is no opportunity for a third provisional license. There is no opportunity whatsoever. This bill would give the Mental Health Board that opportunity to review that candidate and their circumstances. And I just want to review it again. Ongoing medical issues of the provisional licensee of his or her family. We know this happens as a matter of routine. The documented inability to secure adequate supervision. And I think in Ms. Andrade's case, and maybe in several others, that most of the LMHPs are swamped. They are overwhelmed. They can't keep up with their current client-patient load as it now stands. And so in Ms. Andrade's case, she was offered employment with a LMHP to provide that supervisory care, but their workload did not permit that person to provide that one-on-one supervisory time. And then the employer came back and said, okay, we can provide you that supervisory time, but you're going to have to pay for that hour of consultation for that time. And I don't think that is an isolated case at all. I want to be clear on that it does happen. And there is no doubt that LMHPs are incredibly, extraordinarily busy with increasing demands and long wait times for any individual to be seen and have the mental health evaluation and care and treatment that they need. The other thing that I wanted to say, that it outlines or other barriers that the board, mental health board, deems appropriate. You know, what we've heard time and time again last year as well, workforce shortage, workforce shortage. Why are we creating barriers for individuals who want to move to our state of Nebraska and practice their profession and trade, certainly being qualified, meeting all our criteria, but giving them additional flexibility for no matter what their circumstances are? You know, we're not saying that they would be approving someone who is, you know, not qualified to be a licensed mental health practitioner. Why would they have been granted a provisional license in the first place, or a second provisional license, if they didn't meet the strict criteria of the Board of Mental Health and their review and oversight? This is not saying, boom, slam dunk, you got to give them a third provisional license. It's up to the board at their sole discretion, after hearing an appeal from that individual, to evaluate the circumstances. And it also requires that, you know, that individual who would like to be considered for a third provisional license, they have to offer the names and contacts of those people that had acted in a supervisory role for the previous years that they were employed. And so it gives opportunity to investigate minimally to see if that individual is still qualified and meets their strict criteria to be granted another provisional license. You know, I think what we've realized in our state of Nebraska, we need to give some people some grace and do everything we can in reducing barriers to hire more teachers, to hire more healthcare practitioners, to hire more law enforcement. So I don't think this piece of legislation would do anything to denigrate our high quality and standards and criteria for anyone to achieve the licensed mental health practitioner that Mr. Stocking stated. It would actually just be showing like, hey, we value the years that you have already provided that service in our community and in our state. We're willing to review your concerns, but we assure you that you are not guaranteed that third provisional license, and unless the board comes to a consensus on it and agree, or the board can come up with additional criteria besides the 3 reasonable ones that I listed. I think if anybody has ever undergone a cancer diagnosis or a family member, they know that alters your whole life and your trajectory, and you have to address that concern. And they may not be able to work full time. Many of these LMHPs or the provisional licensees are working 2 jobs already to try to get their hours in as well as perform their counseling services. So when we reached out to the other practitioners, and I just want to read someone else who has also been on the Mental Health Licensing Board for over 10 years. She said, I heard from many provisionally licensed practitioners seeking longer than the 10-year timeline to complete their hours and pass the licensing exam. We could never do anything to help these folks because of the statutory limitation. And she goes on to say that this would be a great step in helping those individuals without lessening our high quality standards. It's removing the barriers. That's what we should be doing with a lot of our occupational licensing. We're not dumbing down our standards. We're not dumbing down the qualifications or the criteria. We're trying to embrace those people who've probably spent those 10 years living and working in our state of Nebraska in a practice that they are so desperately needed to stay here. So I find some of the concerns expressed a little bit disappointing. And I think we need to do more. And that's something I think each of us as state senators have been challenged with this year. And we've already been very supportive of other occupational licensing reviews, and especially for veterans and their spouses. So this is a step in the right direction. It's not a slam dunk. You don't get that third provisional license until the Mental Health Board of Licensing reviews your circumstances. And we would hope they would show the same grace to others as they would like for themselves and their family situations.
Thank you. Any questions for Senator Raybold?
And I'd be happy to talk to Mr. Stocking, and at this point in time, I will not withdraw this.
Okay, general question for you. Do you have a sense in terms of how many provisionals might be out there right now? Not talking about knocking on the door of the third one, but just generally speaking, how many provisional licenses are out there?
I do not know the number of provisional
I'm just
licenses
trying
out
to
there,
get a
but
sense as to the size of the issue.
I can tell you that I know that 2 years ago, a tremendous, I can actually tell you the amount, 26 million of ARPA funds went out to UNMC to offer beacon grants to those individuals to encourage licensed mental health practitioners to be mentors and provide the supervisory hours and backfilling those that apply for a grant for that funding, as well as incentives to encourage more people to go to school and get the educational criteria, and to make it easier for more people to become practitioners in the mental health field. And out of that $26 million grant, they went out for one round. This was last year. I think they got over 100 million requests in for that type of grant money. That shows, and everybody is aware how desperately needed. We need to do everything we can to retain our licensed mental health practitioners, but also make sure that those that have provisional license stay in our state. Thank you.
Very well, thank you.
Thanks.
We are up to LB 1138 and Senator Reapy. Whom we have never seen before in this room.
Or at least never wanted to.
Not at all. We'll wait just a moment, Senator Reapy, while there's a bit
Okay.
of transition happening in the room. I think we are ready. Please educate us.
Thank you, Chairman Hardin and members of the Health and Human Services Committee. I am Merv Reapy, that's MERVRIEPE, representing the 12th District of the Nebraska Legislature. Today, I present LB 1138. This bill is brought at the request of the Nebraska Dental Association and has no fiscal note. This legislation puts forth an exception to the e-prescribing requirements for Schedule II prescriptions. Currently, a handful of exceptions exist to address logistical or situational issues, including in-house dispensing or when timeliness is of necessity. Veterinarians are exempt from the current reporting system. To understand the context of this proposal, it is essential to consider the background that prompted the need for such legislative action. Dentists have changed the way they prescribe, especially with fewer opioids prescriptions. A report from the Journal of the American Dental Association in January of 2024 shows a significant drop of 50% fewer opioid prescriptions. Moving on to the specifics of LB 1138, the bill suggests a targeted exemption to the electronic prescription mandate. It proposes that any prescriber writing fewer than 50 prescriptions of Schedule II drugs annually should be exempt from the e-prescription mandate. A pediatric dentist might be a perfect example of this. The software to fill the terms of mandate, our latest estimate cost an estimated $600 per year. It is crucial to highlight that a significant portion of our dentists operate in small offices, functioning as true small business owners. The proposal recognizes the financial challenges these practitioners face and seeks to strike a balance that ensures compliance without imposing undue financial burdens. In consideration the scope and impact of this legislation, it's worth noting that LB 1138 aligns with similar exemptions presented in statutes across other states. Comparable statutes such as those in Illinois, Ohio, Tennessee, Kansas, Colorado, Maryland, and Washington include de minimis prescribing exceptions. In conclusion, we recognize that our dental providers, especially those who write only a handful of Schedule II prescriptions per month, should not bear the unnecessary financial burdens in the pursuit of good patient care. In subsequent testimony, those seated behind me will elaborate on the rationale behind these measures. With that, I conclude my opening statement and welcome questions, and I will stay for closing.
Thank you, Senator Reed. Any questions? They're going to be kind to you for now.
Thank you. Thank you.
Will the first proponent of LB 1138 come forward? Welcome.
Thank you. Good afternoon, Senators. I think Senator Reapy got a copy of my testimony because I was reading mine and it sounded just like his. So some of this will be a little duplicative. Good afternoon. My name is David O'Doherty, DAVID-O''DOHERTY. I'm the Executive Director of the Nebraska Dental Association. The NDA is a professional association of dentists, and we represent 70% of the dentists in Nebraska. We'd like to thank Senator Reapy for bringing forth LB 1138 to provide for an exception to the e-prescribing requirement contained in 1146. Back in 2018, the NDA supported Senator Sarah Howard's legislation, LB 931, which placed restrictions on opioid prescriptions. As a result, what you see the cover of our publication in 2018, Resources for Safe Prescribing of Opioids and Non-Opiate Alternatives. To educate our members on the new legislation on the ADA's research on the effectiveness of non-opiate alternatives for oral pain, namely a combination of Advil and Tylenol, which were found to be as equally effective as opioids. In the practice of dentistry, we have seen opioid prescriptions drastically decrease due to the awareness of the epidemic that the state and country are facing. In a January 2024 Journal of American Dental Association, opioid prescribing by dentists has dropped by 30 to 83%. The majority of dentists across the state practice in small offices and are truly small business owners. The cost of an electronic prescribing system to comply with 381146 is prohibitive for dental offices who are writing few Schedule II drugs in their practices. The changing and prescribing practices of the dental community have been impactful, and dentists across the state are committed to fighting the opioid epidemic. However, in certain cases, a dentist must use their professional judgment and determine that it is in the patient's best interest to be prescribed a Schedule II drug. These instances are limited but important in the care of patients with specific needs due to certain procedures. With this in mind, we would ask that an exemption of the electronic prescribing mandate be added to 381146. Any prescriber who writes less than 50 prescriptions of Schedule II drugs per year would be exempt from the mandate. A de minimis prescribing exception to state mandated e-prescribing is included in a number of states, and I've also passed out of the 7 states that have that exception. Most of them are 50. Illinois, Ohio, Tennessee, Kansas, Colorado, Maryland, and Washington. The Nebraska Dental Association is committed to fighting the opioid epidemic. The actions taken in the past few years have made a significant impact and will continue to have an impact in the future. We ask that an exemption to the mandate be put in place for the providers who write only a handful of Schedule II prescriptions per month. That is all my testimony. I'm happy to take any questions.
Thank you. Any questions? Can you help me a little bit?
Anytime.
give me some examples of Schedule II drugs that opioids are. We're talking
Dr. Stuckelberg can probably name off all of them. I would stumble through. She'll be right behind me. So
Wonderful. We'll make her pronounce-
oxycodone is one that just leaps to mind.
We'll make her pronounce all the hard things.
They're very long words.
Okay, yes, we'll have her do that.
Okay.
Thank you.
You bet. Thank you.
Thank you very much.
Welcome.
Hello, thank you. Greetings, Senators. My name is Dr. Melanie Steckelberg, Melanie, and Steckelberg, Steckelberg. I have been a private practice dentist here in Lincoln for just under 20 years. I also work as a public health dentist at the County Health Department and have done so for the past 16 years. I am the Nebraska Dental Association Treasurer. I am very grateful to Senator Riepe for introducing this bill. LB 1138 would greatly benefit my practice and other Nebraska practitioners like myself. My dental software shows that for the past 10 years, looking back from 2014 to 2023 end of year, I have recorded 158 prescriptions in my private practice. 28 were Schedule III drugs and 3 were Schedule II drugs. I average 13 prescriptions per year and an average of 3.1 controlled substance prescriptions annually. As a member of the Nebraska Dental Association, I started electronic prescriptions at the end of 2023 with a company that provides an ADA discount. The member rate is $54 per month, per provider, per location, or $648 per year for my private practice. Assuming that the monthly subscription fee does not increase over the next 10 years and that I continue prescribing drugs at the same rate, it comes out to $6,480 in 10 years, or just over $209 per prescription at my current prescribing rate. At the public health clinic, I am a low prescriber. Most of my prescriptions are for fluoride toothpaste. While I am a low prescriber, I do likely exceed 50 prescriptions yearly when combining my private practice and public health. But I was under the assumption when I read the bill that this was for all prescriptions and not just Schedule II drugs. So I will tell you that as I have been a person that has experienced significant tooth pain in my life once. So it's important to me that I maintain the ability to help my patients find pain relief when over-the-counter analgesics do not help. The costs for prescribing electronically are only one part of the problem. The DEA permit costs have more than doubled in my career. Currently, I pay $888 every 3 years for my DEA permit. There are also the costs for keeping up with the continuing education requirements for prescribing opioids, which just went up with the MATES Act. There is also the cost for providing minimal sedation in my office, which I need all of this to do that. So as a solo dental practitioner, it has gotten more difficult to pay the bills as these things are now another increased cost of doing business. If you would remove this barrier for providers that do not write more than 50 prescriptions annually, you would have my deepest gratitude. That's the end of my testimony.
Well, thank you. Any questions? Can I ask my question again?
I will try. I mainly prescribe Tylenol number 3 for pain. That's my number 1, and that's a Schedule 3 drug.
Schedule 3.
So I do not have to write that drug out on a piece of paper prior to January 1st of 2024. I had to have a special prescription pad prior to this year that I could write Schedule 2 drugs on, which would be most of the opioid combination. They like to combine an opioid with a low dose analgesic. So oftentimes it will be, say, 30 milligrams of hydrocodone with 325 milligrams of Tylenol or acetaminophen. So to be honest, to get the maximum effect, usually I have to have that patient take one over-the-counter Tylenol in addition to that. There are other Schedule 2 drugs, a whole bunch of them, Percocet, oxycodone, OxyContin. They have all these different names and their different combinations of whether it is hydrocodone or oxycodone plus an over-the-counter analgesic. Typically, it's a Tylenol, acetaminophen. There is an ibuprofen one, but I can't remember if that's still in the market in the United States.
And I realize it's not the main emphasis of what we're talking about today. I'm emphasizing the wrong syllable. But truly, you're saying the efficacy of what you can accomplish, for example, with the Tylenol and an OTC drug is equal to what you can do through these level 2 drugs?
No, not level 2. No,
Okay.
level 2 just has a lot more side effects.
I see.
Yeah, it's, if a patient is willing to try, because a lot of times they say, well, that doesn't work for me. Tylenol number 3 doesn't work for me. I just want the Percocet. That's the only thing that works for me. So if they're willing to try, and they'll do 600 milligrams of ibuprofen at noon, then at 3 o'clock, they can go ahead. We're going to use the clock analogy, and I might be doing it backwards for your view. But at 3 o'clock, then they can do 650 milligrams of Tylenol. Then you get around to the 6 o'clock, and they're going to do 600 milligrams of ibuprofen. And then they're going to jump back to that same dose of Tylenol. If they're willing to do that, if their pain is like a 7 or an 8 on a 10 scale, then I believe I can get them down to a 5, which is not 0, but I can get them down to a 5 by their 3rd dose. But a lot of patients aren't always willing to do that, or their pain is really severe. So I might prescribe a Tylenol number 3, maybe like 10 pills or something like that. And then they're going to take that when the pain is really bad, and then do the over-the-counter in the opposite times.
Thank you.
Okay.
Anyone else in support of LB 1138? Thank you.
Okay.
Is there anyone in opposition to LB 1138? Do we have anyone in the neutral for 1138? If not, Senator Reapy.
Thank you, Chairman. I will be brief. We responded to a drug problem in prescriptions concerning the medication, both in medicine and in dentistry. In that response, I think we're now recognize that we overcompensated, that in the process of doing that, that the pendulum swung, and we included a lot of smaller players, smaller practices, and with that, we imposed on them some significant expenses and obligation in trying to maintain those software programs to e-prescribe. So this is an intent or attempt to bring that back to a more reasonable approach to how to practice. I think that's particularly true in a state like Nebraska, where we have a number of smaller practices outside the urban centers. With that, I will take questions if you have them.
Any questions? Seeing none, thank you.
Thank you, sir.
But Senator Reapy, don't go too far away. Now we're taking a look at LB 1173.
Don't they like to say that an actor likes to play in front of a full house?
Yes, yes. Well, you're going to have to draw the full house, it would
Yeah.
seem.
Okay, leave the doors open.
Okay.
Okay, you ready?
Yes, sir.
Chairman Hardin and members of the Health and Human Services Committee, I am Merv Reapy. That's MERVRIEPE, representing the 12th Legislative District in the state of Nebraska. Today, I present LB 1173. This bill is brought at the request of the Nebraska Association of Funeral Directors. This bill introduces the concept of an abstract of death in statutes, serving as a vital tool when a death certificate is not immediately available due to timing issues. Currently, Nebraska statutes include provisions for an abstract of marriage utilized for administrative purposes. LB 1173 extends this concept to death-related circumstances, offering a valuable resource for managing administrative tasks prompted after a loved one's death. Dealing with the death of a family member involves numerous administrative responsibilities, such as closing accounts and gaining access to various services. Traditionally, a death certificate has been the exclusive proof of death required for these tasks. However, this bill addresses a significant challenge, the potential delay in obtaining a death certificate. LB 1173 aims to resolve this prolonged delay in receiving a death certificate by providing an alternative in the form of an abstract of death. Delays in obtaining a death certificate may occur, especially when a required autopsy is involved, leading to a waiting period of 6 to 8 weeks. Families may face unnecessary hardships during this time, needing to address administrative matters before the issuance of the official death certificate. The proposed abstract of death offers a solution by facilitating the resolution of administrative issues in these limited circumstances. Additionally, 1173 introduces an administrative change to the death certificate itself. It streamlines the process for designating armed forces services on the certificate by simplifying it to a check the box designation. The change eliminates the requirement to specify the period of service, which can sometimes be challenging for family and friends to recall specifically. To provide further insights into the necessity of creating an abstract of death and to answer any questions you may have about the practical implications of these changes, we have a funeral director present today who will elaborate on the importance of this bill and offer a detailed prescription on how these modifications will positively impact the grieving families. In conclusion, LB 73 is a simple proposal that recognizes the complexity individuals face when dealing with the death of a loved one. By introducing an abstract of death and refining the veteran service designation, we aim to ease the burden on families during a difficult time. Those seated behind me will clarify further, and with that, I yield to questions.
Very well. Before we let him off easy, any questions? Seeing none, thank you, sir.
Thank you.
Anyone who is a proponent of LB 1173, please come forward. Welcome.
Good afternoon. My name is Paul Seeger, Paulseger. I'm representing on behalf of the Nebraska Funeral Directors Association. We brought this bill forward because we're running into the hardships with not getting death certificates on time because of everything being done in Omaha now. I've ran into this instance probably six to seven times just this last year, where we couldn't do anything because of an autopsy being done. And so then we were forced to wait, 6 to 8, like Senator Ribby said, or even up to 10 to 12 weeks, depending on if there's a homicide or not. So if there's a homicide, it gets pushed back further. So this helps families get records, shut off accounts, get things transferred out of their name in time, and also just takes a load off them so they're not just sitting here waiting for a death certificate to be issued just so they can kind of start moving on, I guess you could say. As far as the other housekeeping with the veterans designation, the big part with that is the VA does not use that at all. It's really just there to say, yes, they served. It's not used for anything. Nebraska is actually one of the few states that has the dates on there. Another big issue with that is sometimes they give you a discharge paper, but they don't have the latest one. They have a discharge, but not the latest one. Well, if you put those dates on there and then if they can get the official, all of them from when they served, if they did, if they were retired, they're going to have multiple discharge papers. If they can't get all of those, then they want the death certificate amended. This would make that so we don't have to do amendments. It's not needed for anything. It's really just to say, yes, we have the card that they show us that say they served, they're honorably discharged. That's all we need to see. Past that, the VA handles everything that they need themselves.
Very well.
Any-
Thank you.
You bet.
Any questions, Mr. Seeger? I have a couple.
Okay.
Are we talking about a hard copy document? Would this be available electronically? What would this abstract?
So it'd be a hard copy.
A hard copy.
So it'd just be, it'd actually be issued on the same paper that birth certificates are issued on.
Okay.
So death certificates are issued on a legal paper. This would just be an 8.5 by 11 that we already have. What it would do is just take out the section. So it'd be the top section of the death certificate would be there. The middle section where the doctor fills out would be gone. And then we would ask to have the registrar signature on there. So it would be file number and everything. So that way, when the record is completed down the road, that state file number is already there and it can just be attached to the full certificate. Obviously, there would be a cost involved. If they needed this, they'd have to pay for this abstract and then they'd have to pay for the certifieds. But I have a hard time believing anybody would not want to pay for something to have the full amount, the full certificate when it's available. Sometimes it's really hard to wait to tell these families, I'm sorry, you're gonna have to wait a little longer. There was a homicide, so now your death certificate's delayed another month.
I see. You mentioned in passing, all certificates go to Omaha.
All autopsies go to Omaha.
All autopsies go to Omaha.
Mhm.
Okay.
And that's a new thing, just 2023.
23, so for the last 13 months. Okay. Can you imagine a world in which this could be abused in any way?
Actually, a lot of states already have it.
Okay.
We're actually one of the few states that do not have it. So since we don't issue a pending death certificate, everything is put on hold.
Okay.
With the registrar signature, that's what I would feel that it's it proves as yes, the person has passed. It would have the facility, it could have the funeral home facility that they had chosen is on there if need be. But with the registrar signature, it'd be harder to abuse it, I believe, in my view.
Okay. I realize it's not your industry, but how is the insurance industry, life insurance industry responding to these abstracts?
Of course, we wouldn't be able to file for those that need a cause of death. You wouldn't be able to file. This would be, public utilities. Sometimes we could get them if we needed to get a person on an airplane. That could help do that as long as we could get a couple other documents. It's really just to notify the bank so we can show them something so they can freeze the account. For instance, I'm running into an instance right now where we're not going to have a death certificate for so long. If we had an abstract, all they need to show is proof of the person that died with a registrar signature and the person's ID that is the next of kin, which would all be on that form. But of course, since we don't have this, they're kind of sitting in limbo, wondering if it's still going to be there, who all has access to that account, that kind of stuff.
I see. We tend to ask these questions because for some strange reason, it makes us feel warm and toasty out here in the middle of the country. You said most other states have this. How about all of the states that touch us? Is that a common thing?
It is common, yes.
I see.
Yes.
Very
We actually looked at and spoke to some people in Kansas that have it as well. And it eases what it does is it eases the vital records department because they're not having those people walk in all the time wondering where these certificates are at, taking up their time. When we can get this for them, at least it gets them started. It's not the end all be all, but it's a good start.
Okay. Very well. Well, thank you.
Thank you.
Appreciate it.
You bet.
Anyone else in support? Is there anyone in opposition to LB 1173?
Good afternoon. My name is,
I'm
sorry.
There you go. Thank you.
Good afternoon. My name is Chris Klinger. I'm the president of the Nebraska Funeral Directors Association currently. Chris is C-H-R-I-S, Klinger, K-L-I-N-G-L-E-R. The Nebraska Funeral Directors Association is in support of this bill on both ends. So I really just needed to let you know that and see if you have any questions from me from the association side of things.
Very well, thank you. Any questions for Mr. Klinger? It does not look like we have any questions for you, but I'll just open it up to you and say, can you think of anything else that we would benefit from knowing in regards to this?
Well, Paul Seeger did mention the airplane situation. So we do have people that pass away in the United States that may be from another country and they need to be shipped back. And this would help with that. That would be a big thing. This would help as far as that goes. Instead of waiting 6 to 8 weeks, maybe to try and get this person on an airplane, we can have that for that family so they can move on with their services as well. Also with the, you mentioned the life insurance. So this is designed so the next of kins can't move forward with monetary things, meaning they can't access funds or life insurance. It's just to start the administrative processes.
I see.
So, and you had mentioned kind of the devil's advocate of that, and that's what I want to clarify that side of things, that they can't access these funds with this.
Very well. Thank you. Appreciate the clarification. Thank you. Appreciate that.
Thank you.
Anyone else in opposition or neutral for LB 1173? The room's kind of empty. Well, Senator Reapy, will you come up and close?
Thank you, Chairman. I'm not going to take the absence of the attendance in the room as a personal offense. So I would summarize this in 3 ways. This is legislation that's trying to ease the process, ease the burden at times when there's a lot of stress going on due to a death in a family. And they need to have things that may be resolved when they're in town from out of state or whatever, and they need to get these things attended to. Second, important point I would want to know as a committee, it is important to me and other fiscal hawks on this committee, is that there is no fiscal note. And also that DHS has expressed its support, not neutral, but its support of LB 1173.
Good, thank you.
Any
We
questions?
did have one letter in support, none in opposition or to the neutral. Any questions for Senator Reapy? Yes, Senator Kavanaugh.
Well, I'd just like to state for the record that I would have been concerned if there was a fiscal note. So thank you for pointing
Well,
that out.
I know how important it is to you.
It is. Thank you.
Any other questions? Thank you.
Thank you.
And with that, I believe it concludes our hearing today on these 4 bills. Thank you, everyone.
What did I do?
What did you do?
It was the actress, or-
Yeah.
We'd have like 5 hours.
Carnations are flower.
Well, I'm trying to remember that.
They're the funeral flower. So it was perfect timing.
Well, I don't know whether it's perfect or offensive.
Well, why? You had a funeral bill. I was trying to think of what could have happened about, like, nobody was here because they're all dead.
Oh, I see. So you're the kind of comedian who insists on going to at least a half a house, right? So I don't have to waste my talent in an empty room. I'll save these. Yeah, I will save my